We started about 5, 6 years ago when we saw that there was a disparate amount of patients in Southside Chicago that were still getting amputations, just like there are across the country. And we started this by initially changing the culture of our hospital. We did it initially by picking the right team. And it was like physicians like Dr. Gerst and Dr. Julie Taylor, Dr. Ali. We brought these guys in. We allowed them to see what we can do by saving limbs. And they understood. They were passionate about it as well. And because they saw these patients in their own clinic. They saw these patients that were getting amputations and how it affected them and how it affected their social life, their psychology. It's a big deal. And they had that passion from the beginning.
Because I'm a family physician, I see a lot of diabetics. And diabetes is probably the number one risk factor for peripheral vascular disease, one of the major risk factors. So we often check diabetics, we check their feet, their pulses, we send them to foot doctors.
We usually see referrals from family doctors and from the vascular doctors every day. There's a high incidence of vascular problems on the south side of Chicago, and once it's seen and once it's identified, then we use our limb salvage program with our members to be able to get the patients into one of the offices quickly.
The typical interaction is that the primary care doctor and the podiatrist may identify a patient who's at risk for peripheral arterial disease. After that identification, those patients would typically end up in my office. Or if they were inpatients, I end up seeing them in the hospital. Once I've confirmed that they are at-risk patients, then we'll probably pursue diagnostic testing on those patients.
So our podiatrists and our primary care physicians are really the gatekeepers as an outpatient. So they see these patients that come into the office, they have maybe a blue toe or gangrenous changes, and instead of sending these patients directly for amputation, what we did is we worked with them to send these patients for limb salvage.
If there are any signs and symptoms, we get them to the vascular doctor quickly and immediately. We have a system where it's A, B, and C. So when I call the vascular doctor or the cardiologist, I say this is an A patient, which means he needs to see him within a week. A B patient is in a couple weeks. A C is the next appointment. And so we always kind of rank them in a triage manner to be able to get the most serious patients in as quick as possible.
We're diagnosing diabetes much earlier than we used to. We're diagnosing PAD much earlier than we used to. So all of these factors, I think, and then once we find a problem, we're referring them more quickly to get a definitive, treatment.
Since we've been doing limb salvage work, there definitely is an impact. And the impact is multifold. First of all, the patients who come in urgently or emergently, those patients still come in. And that's a consequence of a disease process that's been going on for them for decades already. The biggest impact we've seen has probably been in both the hospital and the clinic in terms of the number of patients we're seeing who are getting amputations. I haven't sent a patient to get an amputation in a long time.
There's definitely a multifactorial, multidisciplinary approach to this problem. And I think we are on the road to helping to limit the amputations that are going on in our community.
What we want to do is spread this program to many other institutions around the country, because it doesn't make sense if one hospital in Chicago is doing this. We want 100 hospitals across the nation doing this. And so using our example, understanding that this is possible, and having the passion and the understanding and know-how to say, you know what, we can do this in our hospital, be it Chicago, be it Little Rock, Arkansas, be it Austin, Texas, wherever it is. Use what we've learned and our knowledge and our understanding of helping these patients and bringing it to their institutions. I think that's the most beneficial thing that can happen.